back there. Calico, did you hear that?
Yeah.
So yeah, it's specific language spoken by 12,000 people back there in Dallas. In Houston area, there is 145 languages spoken at the home. There is language called spoken by 4,000 people. Like you can see that there is many different languages in the United States of America. When we come to the immigration or to the, like first come to the United States of America, first of all is language difference, as you all know. The second one is cultural difference. So there is huge difference between the culture that the people or the immigrants, where they live and when they get to the United States of America. So there is huge difference. Concerning language difference, many immigrants found difficulty to communicate and understand the American concept of the health or health care system. It's very difficult. As a result, the immigrant feel misunderstood or told by the healthcare provider at the WIC office or any patient with a limited English proficiency has been associated with the longer hospital stay, that they stay in the hospital for a long time. Second thing, increased risk of medical error. There is 100 cases of medical errors with those people with the language barrier. And the third one, less specification with the clinical care, thousands of dollars. The government should pay for that. According to the Census Bureau or CDC, almost of the new admitted to the Lincoln, Nebraska, like that in 2015, 2016, 1,400. So as healthcare professional, what we should do, it's our role to educate the community about this program. It's our rules to educate the community, to let them know what's going on. So we should try to eliminate this gap that exists between the population. So the elimination of the health disparity is one of the major public health goals for the current decades. So what is health disparities? Could anyone of you tell me what's the health disparities? Okay, health disparity is the gap that exists between two groups of the people for the access to the health care. So one of them is able to get to the health care, but the other one's not able to get to the health care. So one of our rules as a healthcare professional and public health, we control over this system. Let's see what literature review telling us about this topic. So by digging in the literature review, you will see there is many barriers that prevent the immigrant access to the health care. First of all, communication barrier. So as you know, like he's getting from the different culture, different language. So he didn't know how to get to the hospital. What's the language? How to communicate with them? So there's some communication barrier. Second one, lack of the health insurance. Thousands of them, they didn't have health insurance. Big problem. Third one, healthcare cost. It's expensive. They can't buy it. Work for issue. His manager didn't let him to go to the hospital. You should stay. He's working in the McDonald's. They didn't allow him to go. Legal states. According to the House Center for the Hispanic people, there is 12 million Spanish or Mexican people who living in the United States undocumented. They didn't have any document. Huge number. Transportation, the last one.